Hello, everyone. Welcome to the R.E.A.L podcast. Just a quick disclaimer. If you are sensitive to topics such as obesity and weight management, please click away now as we will be discussing that in the following cast. Thanks, everyone. Enjoy the cast.
We never even ask each other this. How are you?
You trip me out, Max, because I feel like we have such a psychic link at this point that we don't even need to ask how each other is. We can kind of just get a vibe. The way we answer the phone, don't need to speak. It's just that kind of like instant connection. I'd almost say it's paranormal at this point. Someone should do a study on us, and I think that'd be quite interesting. I'm doing pretty well. I just came back from a leg session and I nearly vomited, so that was a decent effort into actually putting some effort into muscle growth and hypertrophy. So I'm currently on a semi-intentional calorie deficit, which is an interesting topic to talk about if you'd like to go down that route. How are you, Max?
Well, look, I always feel really bad because you always inquire about me. You always checking in with me, see how I'm going, all that. I never ask you.
So I honestly don't even notice. I don't even notice.
Every time I answer the phone, Matthew's like, Max, like, tell me about your day, man. Like, you feeling all right? Like, how's everything going? And I never even bothered to ask him back. So I do feel bad about that. But no, that's good to hear. Talking about what's going on. I'm doing well. Thank you, man. I'm doing well. But curious to know about you and your leg training, all that. Let's delve into that a bit because I think that could be interesting. Talk to me about what your goals are at the moment and also what you were doing at the gym. I'm curious.
Sure, absolutely. I think this is probably an interesting area. So gym has been an interesting journey for me thus far. I started when I was about 16 or so. A few mates were going, thought it might be a fun thing to do. Never really did any exercise at all before that. So it was very much a kind of experience of did karate up until I was like 9, maybe 10 years old. Decided, yeah, kind of over that thing. A period of time where I would avoid pretty much all sports unless it was actively really fun to me. So I found soccer enjoyable, but didn't really play it as a team sport. It was mostly just whenever it was like at school. So, okay, 16-year-old comes along. Oh, yeah, gym sounds like fun. I didn't really tick the prerequisite of insecure about my body or anything like that. So it was kind of just like, it sounds like an activity that I might enjoy. So I might give it a go. And then a few other mates hanging out. So I decided to do that. And we kind of quickly delved into, I would like to say more evidence-based training, which was, I guess, a blessing in disguise. So it was very much a period of time where we would aim to make the most of our kind of newbie gains when I actually thought it was a certain time period. So at the point in time, I thought newbie gains was a very time-centric approach that you could gain so much muscle in a certain window of time versus a certain, I guess you would say, like amount of progress that you could you could measure in your body. And I'd love to discuss that in a second with you as well. So went kind of...
I love that. I love that you said that. It's great.
Push, pull, split kind of situation. And then that's pretty much stayed relatively consistent with a few modifications. You can tell my brain's absolutely fried, hence the leg day.
Cool. No, that's great. And so you did legs today. What was your training like? What exercises did you do?
At the moment, it's kind of doing whatever I enjoy, which I know is not optimal in any sense. But at the moment, it's kind of aiming to get into a routine that better suits my lifestyle and can turn into more of a habit again. So I've fallen into a trap where if my life gets busy, whether it's with the business or whether it's with family things or friends things, usually with the business, it'll be, okay, first thing that goes is sleep, as with a lot of people. I definitely don't see sleep as something that you can expend. It's not a resource that I think you could get rid of, but often things tend to creep in, sleep tends to fall off, and as a consequence, my energy throughout the day is reduced. A lot of my energy is spent focusing on things that require mental attention versus the energy that I have at the end of the day when I usually used to train, which I would kind of run out. So gym has been quite on and off. So it's very much trying to get back into things, usually along those lines. At the moment, so today was pretty much just legs. Occasionally I'll add in additional deltoids or traps or something along this line. So I start with a few stretches and squats. So my mobility isn't amazing. With squats, I tend to do a fair bit of lunges at the start, so like just free weight lunges, trying to get that mobility opened up. I find that allows me to be less tense and less unstable when I'm squatting. And from my perspective, I know that I can push harder, more total weight and more, I guess, effort if I use a Hacksmith machine or something along those lines. hack squat machine. But I find that squatting provides a level of stability that allows me to feel better throughout the week in my lower back and hip kind of region. So that's why I tend to increase and just have squats as a staple. Of course, I'm predominantly sedentary when I'm not exercising. So ensuring that I have that amount of exercise through a wide range of motion is quite important to me. Very much working on my form. So I'll do a warm-up set, a couple of warm-up lunges, potentially some kind of stretches, which I definitely don't know the names of them. I can't really describe them. Also just wailing my legs around and seeing what happens or what helps. Shush you. And in terms of brutal. So
Matthew's
rude
got
on the
his
phone. And in terms of what I would normally do from that, it's the pizza guys at the front. I need to go say hello. And in terms of, so one set of warm-up squats, usually around a 60 kilo mark, which is probably about probably say 75% of my 1 rep max. And then I'm probably my working sets at the moment are about 80 kilos. For reference, I think I weigh about 67-ish kilos at the moment.
Cool.
So slowly working up. It was a period of time where I could not even get over 60 kilos for squats. So I've come a fair way in that sense, but it's very much a long process. Do you want to comment on anything before
Awesome.
I get to the rest of my workouts?
Yeah, look, I guess we'll start from the start, really. So I'm curious about the stretching. What sort of stretching are you doing at the start?
The stretching is more dynamic. I find that the static stretches don't really work as well for me. So if I'm doing, let's say, static varieties, I'm often kind of bouncing in the kind of range of motion, if that makes sense. So it'll be trying to touch my toes, get that kind of moving along in the dynamic stretches of like the lunges. It'll kind of be going a little bit deeper, lunging back and forward, really trying to push that motion. Let's say this is my foot, really trying to get, I'm not doing a very good job as a reference because my of course my hand can't move that far, but really trying to get my knees as far over my toes as possible, because I find that throughout the week they kind of snap back, if that makes sense. And I know that is a limitation in terms of my stability when I am squatting. So knees over toes is something that I try to do as much as I can. I often need a wider squat, which I think is just due to my anatomy. So that's generally how I start. Sometimes if I can be bothered, I'll do a little bit of cardio at the start just to kind of get everything moving, everything pumping, especially if I've had a sedentary day where everything's kind of just stagnant. It's very useful to kind of get the blood pumping full stop, which is a very light cardio session, probably zone 1, maybe zone 2 if I'm thinking about it.
Cool. Yeah, nice. Look, from the start, I think stretching would probably be best to be left at the end from a injury prevention point of view and total performance point of view, muscle growth. But it's not going to be something that's the end of the world. You know, it's not going to be a deal breaker, but it would be something that, in my opinion, would be worth considering doing at the end, just for there's only pros doing it at the end and there's only cons doing it at the start, really. So it's not like a pick which one you prefer more. It's more of like this one is just objectively better. But everything else sounds pretty good, man. Like with the lunges, look, you know, you got different camps of people who just go straight into the squats versus, you know, people that do a bit of a warm up. But I like, you know, either's great. You said the lunges you're doing with dumbbells. You said it was free weights. Is it dumbbells
completely
or
free weight? So it's very much just trying to use
so like
my
no
body
weights
weight
at all.
No weights at all. Yeah,
sure.
It's very much just trying to use it as a stretching technique rather than a weight loaded exercise, which is probably not so conventional. I haven't really seen too many people do that kind of thing. But it works for me in terms of making everything feel better, and that anecdotal provides a little bit more of a safety factor in my mind.
For sure. And that warm up in and of itself is fine. You know, a lot better than the stretching that you're doing before that. Absolutely. That's definitely the way to go. And then, yeah, sounds like the squats is great. You know, as long as I've seen your technique's absolutely fine. So it sounds like a pretty good start. What are you going towards after that? What are you gravitating towards? And also just really quick, just comment, you know, you're mentioning how you're just going in to enjoy it and doing what you enjoy. And there's a lot of, for some reason, there's a lot of shame. There's a lot of shame in going to the gym and bodybuilding in general because people do shaming, right? So people feel embarrassed to be honest about the way they're training because for some reason, people like to put down others. And I really don't like that personally because At the bottom of the rung, we've got a big pyramid of what's most important for training. Number of sets you're doing, the R.E.A.L, or the intensity you're doing it at, what exercises you're choosing. There's a whole bunch of different things, that matter. At the very bottom is doing it, full stop. Arriving at the gym and going to the gym, consistency / enjoyment / all that type of thing.
Absolutely.
And if that's the thing that gets you to the gym, like for example, that's the thing that gets me to the gym. I over the past, as I've discussed over this cast, not this one in particular, but this is a group of videos that I've pulled away from the gym a lot. And the thing that gets me going to the gym is thinking, oh yeah, I'd like to do that exercise, or that'll be fun, or like the thing that keeps me in there. I'm halfway through, I'm like, oh man, I'm not vibing it right now. I really want to go. And I'm like, oh no, but it'll be fun to do this. So then I'll do something that I enjoy. And incredible, right? That's what makes the difference. And considering when we look at how much different it would be to doing the most optimal thing, you're talking percentages here and there. You're not talking big, massive differences between the amount of muscle you can grow. So I think that's commendable. Commendable to be honest and just say I do it for enjoyment, and I'm not trying to be some amazing nerd, optimal nerd boy.
My optimal nerd rage game. Yeah, absolutely. So I try to practice what I preach as much as possible. And that is exactly what I preach. I'm like, yeah, go to gym because you enjoy it and you want to be there, not because you're forced to do it because a dietitian told you that it's good for your health and you have some health goals. It's like, if we're able to enjoy the process, everything becomes so much easier. And you don't necessarily need to go to gym. If you like team sports, do a lot of team sports. If you like gymnastics, do gymnastics. If you like CrossFit, even do CrossFit. Although I would say the risk of injury with CrossFit is a little bit too high for my own personal taste. But if the consequence is you're sitting at home doing nothing, I would absolutely take CrossFit over that type of situation for my overall health and well-being. And I think the mental health aspect is one of the things that gets swept under the radar a fair bit with these kind of scenarios. There's so many benefits to exercise and mental health. It's absolutely insane. And I was in denial. Especially before my 16-year-old gym phase. You don't need to exercise to feel better. That's ridiculous. How can doing something physical lead to something mental? They're not linked. They are absolutely linked. There's so much good literature supporting the amount of amazing benefits you get from physical activity. I think just from acts of depressive symptoms alone, it's almost like, well, why wouldn't this be prescribed for every single individual who has some negative health mental impacts?
Yeah, I think it relatively is pretty much. I don't think there'd be too many psychs that would not prescribe that, not prescribe a significant amount of physical activity for people who are experiencing those symptoms. Talking about mental health and sustainability, I was literally discussing this 6 hours ago with someone, and we're talking about mindfulness and mindfulness techniques and ways to stay present and reduce anxiety, because at the end of the day, that's something that's really important, right? Reducing the cortisol, reducing anxiety, being able to chill out rather than being so stressed out the whole day. And we're talking about different techniques that you can implement throughout the course of the day, or whenever you feel like you need to, or at a set time every day. For example, when you wake up in the morning, or like before work, you could have a few as need be, more of the reactive kind of thing, and then a few that are set in that are proactive.
More habitual, persistent, that kind of thing.
Nonetheless, we're talking about it. And I was saying for me personally that a lot of the strategies, such as doing the breathing, listening to someone talk, or doing these weird, no, sorry, that's not fair, doing strategies, I would find them very boring, and I wouldn't be able to stick to them just in reality. And the good thing is we were able to have a really open discussion around that. It's important to be super clear about that. You can tell the older you get, the more you learn yourself and know yourself. You know if you're going to enjoy it or not. You know if you're going to have a good idea or not. And I knew from the get-go that if I was going to do this, if I was going to commit to this breathing thing, that I'd get bored of it and I'd quit it after a week. And then there goes, for me, and maybe I'm misinterpreting things here, but I interpret that as self-respect. Because if I can't stick to something and I can't be disciplined enough to do it and see it through, then I lose respect for myself. And then that means that it's kind of a cascade, right? Oh, I failed at the mindfulness as well, so may as well fail at this too, and then may as well fail at that. You know what I mean? Whereas if you hold yourself to a higher stringent, you're not going to allow yourself to fail. So I knew I was setting myself up for failure, so to speak. So I was like, look, I'm going to be honest, I actually wouldn't be able to see that through. What else can we do? And we're able to find out a way that would actually work well for me and what I would enjoy to do. So I think that's interesting. I think that's interesting to be super honest with yourself and super honest with the clinician and person you're talking to as well, to say that thanks for giving me the idea. You know, thank you for giving me the mindfulness idea or this idea to eat this food, but I actually know I wouldn't enjoy it and I wouldn't want to do it. What do you think about that overall?
I agree. Absolutely. So I think it's a really great thing that honesty is paramount. You cannot go throughout the session lying. If you're doing so, you're doing yourself a disservice, because the entire reason that you'll be having a conversation with a practitioner or a clinician or anything along those lines is that you want to improve your own situation, not the imaginary person that you're presenting as a facade. And that facade can be perfectly fine sometimes. I think there's time and place where a facade is required. For example, in my networking or in my social media, I don't want to kind of come across as like if I've had, I don't know, say someone messed up my coffee order in the morning. They gave me almond milk instead of full cream milk. I'm going to be absolutely distraught. My day is completely ruined. It's not actually, but I don't want that to come across in my social media, because of course I'm trying to make something entertaining. I'm trying to make you smile or be informative, but also keeping an element of realism that something did happen with my coffee in the morning, and it's not all sunshine and rainbows. Again, in that same scenario, if I'm having a conversation with, let's say I'm going to a physio, and I'm like, hey man, really looking to improve my shoulder. My shoulder's busted. Really need to like just fix it up. Can you give me like, I don't know, massage it for 5 minutes and then it'll be good? And realistically, this physio is probably going to tell me, hey, if you want your outcomes, you need to be doing additional exercises and rehabilitation between our sessions. The massaging will help to a certain degree, but you're leaving a lot on the table. And then it's up for me to decide, okay, can I actually implement these strategies that he's recommended, or she? Or is it a scenario of, I guess the massages will have to do, because in reality, I may not be able to do that kind of scenario. So, or do that thing that he's recommending. It's a tricky situation, because it may be that if we set ourselves into that block, into that cube, I can't do it. Often I think we can get trapped there. But if we give it a go, something that may be plausible, something that's like, oh, look, I'm probably gonna, and again, it's really depending on how you phrase it inside your own head. If you say the term, I'm probably going to fail this, you're already setting yourself up for failure. If you say, I may be able to succeed, that's almost the exactly same thing, but it's a half glass full instead of a half a glass empty. And that entire rephrasing and reframing of that scenario can completely change your outcomes of how you approach that situation and your clinical outcomes. So I'm like, okay, maybe I can do my exercises during the week. That might work. That's completely different to be like, oh no, I probably won't be able to do that. And giving that a go, even if it doesn't work, you've given it an attempt where previously you're almost setting yourself up for failure and not being able to do that in the same scenario. But of course, if he's telling me to do, hey, you need to do 3 hours of physical activity per day for an optimal recovery, I'm not going to spend 3 hours doing some shoulder rehab and then finding a balance. Is that 3 hours going to provide me much of a benefit over 15 minutes? Or is it more so just like, this is the optimal route, and if you want to do it optimally, this is exactly what you'll do? If you're a sporting professional, then absolutely, I think I would go down that route. But I'm just a normal bloke who wants to get through his day and not be in too much pain and consistently live and do all those kind of things. So I think there's a bit of a balance that you need to be aware of your limitations as a person, but also be open to trying and attempting to push those boundaries always. If we get stuck in our own little bubble, we can often find ourselves unable to proceed, unable to adapt, unable to deal with the stresses of daily life. Just a quick ad break. We're now currently taking clients by the link in the description or via our website. Back to it.
Interesting. Yeah, look, it's an interesting way of looking at it. Definitely a different way of looking at it, for sure. Because I'm definitely inclined to, it's really important to me if I commit to something to stick it through and hold myself strictly to that if I make a commitment to whatever it is, that I see it through. And so, yeah, I don't want to commit to things and overcommit to things on the basis of that, because it is so important to me to do that. I think you brought up a really good point about the physio. So when you're talking to, like, talking about mental health is a pretty long-term game. It should be minimum midterm, but probably long-term in the sense like could be for years and years or decades that you maintain this. So when you make a commitment to your mental health, you've got to be sure that you can sustain it for a long time, or doing something every day. For your physio, it's very different, right? It could only be a few days or a week or like a couple of months at the most. So it doesn't really matter. It's different application, right? If you dislike doing the physio rehab, it doesn't matter. So what? Just do it. Do it and be quiet, because it's going to be over soon. But if you are having to do something and force yourself to do something every single day for a very long period of time, that's when there needs to be the consideration of, well, I actually don't enjoy this. So what are other options do you have for me? Whereas if you come into a physio to do shoulder rehab and the physio says you need to do these exercises, and you go, oh, nah, Soz, I don't enjoy it, I'm not going to do it. So mate, do it for 2 weeks and you'll be fine. Like, it's not that deep. So, and I think that's where dietetics is really interesting, right? Because we've got two sides to play here. We've got the side who is long-term, looking to do things for potentially the rest of their life. And we've got the side that's short-term. They have lost a significant amount of weight and we need to ensure they don't lose any more weight because they're malnourished or whatever it is. And it's like, you need to be having a significant amount of nutritional supplements to facilitate this weight regain or at least weight maintenance. But this isn't going to be for the rest of your life. This is just going to be temporarily for this thing. So we really do play the balance of both sides of the coin. And I think that's an interesting aspect of dietetics that you don't really find much in other disciplines, really. I don't think.
It's a really great point. A really, really great point there, Max. I'm at a bit of a pause. So I think there's probably some things that I'm not acknowledging.
Yeah, realistically. There would be. Nothing that I can think of off the top of my head, though. Yeah.
There is definitely elements where I'm like, you need to reevaluate your situation right now. In the same sense that there is dietitians in hospitals, which I had no idea about up until third year uni. I'm like, wait, dietitians are in a hospital? That's crazy. Like, what are they doing there? Why are they telling, like, there can't be weight loss in hospitals. That doesn't make sense. And then, dietitians don't just do weight loss. Okay, that makes a little bit more sense. It's what are the problems in hospitals? The complete opposite, that people are losing weight. So you want to make them stop lose weight. It's a mind blower for the normal person in the population. Doesn't realize that dietitians aren't just the weight loss people. Preventing serious conditions from deteriorating and progressing further is a major important short-term goal that we set. And then once you get out of the hospital situation, then you're in the community. If you would like to continue on with some dietitian support, then we can establish a plan for you moving forward so you don't have to get back into that hospital situation. It's a very interesting scenario. Very, very interesting.
Yeah, for sure. Let's go through. That was a really nice distraction that we allowed ourselves to have there. Exercise number 2, Matthew. It'd be cool to see, it'd be awesome would be to see a mind map of how we went on. Like, it's, like in Wikipedia, how people do the challenges of like Michael Jordan to a bonsai tree or something like that. Like, how they do the links?
Yeah.
It'd be cool to see the mind map of how we got to that final talking about dietitian hospitals there.
Oh, look, it's I don't think that's possible, but we'll see, I'll reframe it. It may be possible. In the next exercise. So in terms of squats, I would normally do 3 sets of around 8 reps, all pushing to the point where I think I'm about 1 to 2 reps in reserve. I'm generally aiming for this because I do like to push myself closer to failure just because of the feeling of it, and I feel like I'm accomplishing something. And I do notice that if I do that consistently, I am working towards improving my strength overall, and often it's a nice bonus. Like, oh, cool, I'm achieving something. It's nice to achieve something every now and then, tick off a box. It's a good feeling. Moving on from that, I would usually go to doing some version of RDLs. I'm probably doing them completely incorrectly, but I do find that they target my hamstrings quite well. Dumbbell RDLs. I do have a slight bend in my knee, as I feel that my inflexibility limits my ability to target my hamstrings unless I had that slight bend. I don't know if that changes the form or the type of exercise that I'm doing, but I do find that it still targets my hamstrings because I'm destroyed the next day. So I'm feeling totally fine right now. At the time, I feel like doing the exercise and feeling like I'm vomiting, but the next day it's very persistent DOMS. It stays around for a fair bit, but I noticed my hamstring strength over time has dramatically increased with specifically hamstring curls. I don't notice it as much with RDLs, just because I think there's so much concentration going on. And my form is so variable, which is something that I'm actively working on.
Yeah, interesting. Yeah, look, with your RDLs and stiff-legged deadlifts, so typically your RDLs are more for glutes bias, and your stiff-legged deadlifts are more for hamstrings, and they both do obviously both. It's not like one isolates the other. But yeah, as long as it's soreness isn't the be-all and end-all, but it's a pretty good indication that you're working the muscle decently well. And if you're not too sore, it's probably a good indication you've worked at a good amount too. So that sounds pretty good. Without actually looking at a video, it's hard to go over anything in particular. But the cue for all this is always having soft knees, so not much of a bend in your knee, but soft knees so they're not locked out. And then, yeah, essentially as long as you keep that, you don't allow like what's called posterior pelvic tilt. So essentially like what is a lot of people call butt wink. The posterior pelvic tilt is just a stupid name for it. I don't know why I said that. And yes, as long as you don't allow too much butt wink, like what you see in a squat, the same for an RDL, then you're probably going to be absolutely fine. And keep it really, really nice and controlled eccentric. Taking videos of yourself, I found taking videos of myself doing my SLDLs to be really, really important, because I always felt like the eccentric was insanely slow. But I would review the footage and I'd realize it's not at all. And I also noticed that I thought I was going harder than what I was. It felt extremely difficult. And then I looked back in the footage and my last rep appeared to be relatively easy. So really good element on this exercise for me personally to review that footage and have a look at, okay, look, my technique's fine. My technique isn't breaking down at all. Looks like I can actually push harder than despite feeling like I'm about to die. And I also need to go a bit slower on the eccentric despite me feeling like I'm going 1 kilometer an hour down. So that's just my thoughts overall with that exercise. But it sounds like you're pretty much all over it, really. How many sets are you doing of that?
Usually aiming for about 3, up until I notice that my form will start to deteriorate. Then I might move on to something else more, let's say, isolated. So I might move on to hamstring curls if I notice that my form dips and I still want to target my hamstrings a little bit more. Don't know if that's correct or not, but that's generally the aim that I go for, just to make sure that I've kind of actually worked them rather than something else that might be a limiting factor, be it my lower back, which I have notoriously not been the most strong of my body parts. So just trying to keep that in mind. And then depending on that, I might move to quad extensions.
Good on you. The technique shouldn't be something that should ever really dip anyway, no matter how tired you are. But that's good that the reality is it's good that you're stopping at least, not continuing going on. Just as a little note, 3 sets of the RDLs or SLDLs should be plenty. You really shouldn't need much more than that. You might, but what I've noticed just through experience, and this could be completely wrong with you. You could be someone that I've never seen before, but from my experience, that's plenty for your hamstrings and glutes. They don't need much, and especially something as disrupting as an SLDL or an RDL. That's plenty. I used to do, 2 sets for me would absolutely destroy me. I'd be dead, and it would be too much for me. 2 sets. So
interesting.
Just something to think about. But if it's not, if you need the extra volume, then you need the extra volume. It's like if someone came up to me and I was like, yeah, man, I do about 6-7 sets for biceps, and he goes, nah, bro, I do 2 and I'm cooked. Like, congratulations. That's great. I'm not you. I don't care. I need 6 or 7 sets to get the sufficient stimulus I need. And so it's like kind of the same response. Like, for sure, you always got averages and what the amount that most people need to get a good stimulus, but you might need more. That's absolutely fine.
And it's a very interesting thing that you bring up as well. So I'll only ever move to like a hamstring curl if I've noticed that I can't complete and it's probably just why don't I just move down in weight for SLDLs or RDLs or whatever I'm doing at the time. Why don't I just move down in weight to maintain my form and do the rest of that exercise? But my brain is kind of like, well, a hamstring curl sounds fun, so I'll go do that instead. So
yeah, they are fun.
I would say definitely not optimal, but it's something that I tend to lean towards. Interesting enough.
No, look, it's actually pretty good in my opinion. I think it's good starting off with a RDL and moving on to a hamstring curl of sorts. I think it's actually a really good decision, a really smart decision, to be honest. Cool. So that's basically your top 3. What are you moving on to after that?
Then it's generally like I only do 2 exercises more usually. So it'll be depending on how fatigued my quads are, I may move on to, and there seems to be a lot of variability in my leg days. I may move on to quad extensions. Now I've had a history in the past of having quite sore knees when I used to do quad extensions. Looking back in hindsight, if I had a camera I could show you, I was maxing out the machine when I could not even squat 60 kilos, but I was throwing my legs up, throwing them back down. My form was absolutely atrocious, and there was just a lot of load on my knees. It was not good. That kind of set me up for having a little bit of sore knees moving forward. Whenever I do those quad extensions, I notice a fair bit of growth, but at the expense of my knee health in the short term. If I do quad extensions now, it's very slow, very controlled, controlled eccentric all the way down, controlled concentric all the way up to the point, and then stopping to the point where I'm not, I guess, hyperextending and putting additional pressure on my knees. I don't know if that's an actual thing that happens, but I've noticed that I do find myself having a little bit more soreness if I'm locking out my knees, I guess, if that would make sense. So I usually do a few sets of those, relatively lightweight, for what I think I could actually do on that quad extension. So I usually aim for about 47 kilos roundabout. And I usually do a warm-up set with that quad extension just to make sure that my knees aren't feeling funny. I'm not going to do something weird, because I have had some little twinges in the past with it. So something I'm a little bit more cautious with, but also to kind of finish off my quads. I do notice that my quads don't really have the same DOMS response nearly as much as my hamstrings do. I think we had a conversation about that in the past, Max. The hamstrings are just one of those muscle groups that have more DOMs and take a little bit longer to repair than quads.
Yeah, 100%. And that's just, again, this is all from experience, all anecdotal. I don't even know if literature exists to support this. And that's where you really need to be just intelligent in terms of being able to choose where you get your evidence from, in the sense that in a field where it's not like mathematics, where there's always an answer, you need to have a really good head on your shoulders to decipher between where am I going to go for literature? Where am I going to go for experience? Where am I going to go for personal experience or anecdotes? And that can just be one of them. Just understanding that there's people who have done this a lot, and they can go, look, just by virtue of experience, I can confidently say that a lot of men in particular get very sore hamstrings very easily with not much stimulus, with seeming to be not much stimulus. Now, there could be actually lots of literature out there, on the muscle fiber types or whatever it is. But yeah, that is just something that I have noticed. Interesting that you decide to do the quad and then hamstring, glute, and then quad. Is there a particular reason why you go back to quads?
I generally find I need a little bit of time to recover from squats to do quads. I find that if I give a little bit more time in between that, I can perform better in the quad extensions total reps wise than if I just jump straight from squats straight to quads. I'm kind of cooked. I need a little bit more time, a little bit more ability to recover, I guess. And I think there's a little bit of evidence to support the utilization of nutrients in the muscle for, I guess, energy use. I do have a little bit of a pattern. It's probably a bit embarrassing to say. I do have a pattern of under-fueling before leg days. So I tend to do most of my training sessions towards night, which usually pushes my dinner to be a little bit later. So I've come from a few hours since I've had lunch, and then I usually don't have a high GI source of carbohydrates in the house around me. So I'm kind of scrambling. I'm like, a low GI piece of bread. Yeah, you get in me. And then trying to kind of do a full leg day, hence why I'm probably so exhausted at the moment. So that's generally my logic behind jumping between those.
Okay. Yeah, sure. Not probably something that I'd recommend personally, not something that I'd be super keen on you doing, but yeah, it's going to be personal preference. It's not going to make a massive difference in the grand scheme of things. Just like everything, I don't think anyone could tell me they're doing something that isn't completely stupid that is going to make a really big difference. All these things that are more or less inconsequential and little things here and there that you can kind of clean up and tidy up. And if you're like, nah, man, I just much prefer getting my 2 big movements done at first up and then moving on to the quads, or you prefer, having that bit of time to rest up, or it could be a bunch of reasons why you like it, Sure. Go for it, man. That's good. And what would it be like? You didn't say with like 3 sets or something on that one, or what are you looking at for that?
Usually. So it's very variable. So that one's probably more so on how much I can actually do. I tend to aim for around the, I would say 7 to 8 rep range. If I notice I can't even get to the kind of the 6 rep range, I'll just call it and be like, okay, no, I'm pretty cooked. I'll
Sure.
end my quad extensions for that period of time. So it might be 2 sets, it might be 3 sets, but usually I'm aiming for about, I'd say on average, it's probably about 2.5-ish sets, probably 2 sets, 5-6 reps.
Cool. And what are we looking at for rep ranges for this one? Oh, sorry, you already said. Sorry, my bad. It's late. It's late, everybody. Don't freak out.
Yeah, it's interesting how you mentioned Max. So I'm currently doing my sports dietitian course, and the key limitation for the use of studies and data that I'm aware of is not necessarily the amount of data that's out there, because there tends to be a fair bit of the data. It's specifically the application of that data set to the specific athlete that you're talking to. So it might be, let's say we have pretty good evidence for, I don't know, let's say on quad extensions, moving the chair as far back to increase total, was it a flank? Is that the
Flank
term?
fitting?
Like flank growth? Yeah.
Right. Yeah.
Sure. For I guess for a majority of the population, that probably applies, but I think it may be a little bit more nuanced with a certain few people on how they respond and if they can actually do the entire workout at that length. Potentially there's some metabolic adaptations, potentially there's an inability to cope with the stretch response. Just something interesting that I think is applicable. So data out there, whether it applies to you, completely separate story.
Yeah, I love it. Yeah, no, I love it. Yeah, for sure. And then after that, so you said usually one more exercise after your leg extensions. What are we looking at?
The calves. So
Nice.
Everyone complains about calves being tiny. I've never really thought mine were incredibly
don't care about it
small.
either. I don't know why everyone gets so hung up. I think people who have bad physiques or like get worried about physiques get hung up on their calves because that's kind of their outing to be like, nah, bro, I got bad calves, man. Because like that distracts them for like the rest of their pad.
Potentially. Yeah.
But yeah,
I feel like people who
I
are
never
concerned
understood
about their
it.
calves are concerned about their Johnson size as well.
I think every guy is, bro.
I'm happy with my 2.5. It's centimeters. It's very useful.
Yeah, because I was going to say that's pretty big. I was going to say in inches, that's massive, but I'm glad you clarified.
Yeah. Just to make sure everything's out there. So I usually go for calves. So really, I very much adopt a similar method to kind of the Dr. Mike Israetel, really slow eccentric, very deep stretch, and then coming up relatively quickly and then kind of repeating through that exercise. So I've noticed that my calf strength has dramatically increased. I think when I started exercising, I was doing maybe 30 kilos. Now I'm up to 105 for 3 sets. I aim for about 10 to 12 reps. But in that scenario, I have to readjust my feet halfway through every single time because they end up slipping. It's very annoying, and I'm trying to play around with footwear, but I notice if I play around with footwear, sometimes my form with my squats can be impeded because I may have like a heel on my runners or something along those lines, or it's a little bit less stable in certain things. So I usually run leg days with my Vans or a flat foot situation. I may just bring along glue next time, so just kind of squirt it on the foot of it's a standing calf machine. I do prefer. I was in Adelaide at one point. For the international viewers, Adelaide is a fair bit away from Melbourne,
A province,
and then which is a hypnoscope, and Melbourne is just a little bit more of a jump from Sydney. So I was in Adelaide. There's a really absolutely. There is a Melbourne in USA, which it trips me out. Or is it a Richmond?
Quick ad break, guys. Remember to click the first link in the description to check out our dietitian consultations and services. Back to it.
There is a Richmond there's a Richmond in England.
Too many of them.
I think there is. Yeah. Anyway.
People get bored with naming conventions. Yeah. There was a really cool place in Adelaide. Completely forgotten what it is, but there was a seated calf raise machine that perfectly fit your angle of how your leg actually works. So instead of you sit, because I've had too many sitting machines where you sit on it and then the padding will kind of squish up, so it's kind of like a point on just one specific part of your quad. And by the time I get to the calf raises, my quads are absolutely destroyed. I don't want anything touching it, including my own skin. So I'm trying to rip off my skin, let alone having the machine on it. So I usually go through a standing. I spread my arm out pretty wide, because I've noticed if I don't, I get really bad blistering or blood vessel popping. Have you ever experienced that, Max? Yeah, so I've got relatively bony shoulders. I just need it's a sign that I need to work on my delts, of course. But it's, from what I'm aware of, it's relatively common that on those kind of standing carb machines, or potentially even standing hack squat machines, the blistering or kind of a redness on your shoulders can be like micro blood vessels bursting.
Yeah. I get that all the time.
Cool.
Yeah.
Yeah. So I'm generally standing 105 kilos, aiming for 10 to 12 reps. Usually I get to about 2 sets and maybe about 8 reps before I start to be like, okay, cool, I'm completely cooked. Cool. Then my rep range tends to go like a little bit more of a blip instead of a full up and down range of motion.
Yeah, for sure. Yeah. Matthew, to finish off, I've got a little set, because that's it, right? And then you're going home and chilling out.
Well, then my last exercise is walking down the stairs, which is the most difficult one. That's brutal. That's cool.
I've got a little segment for us before we finish up, and it'll be perfect timing because we don't want to do a whole nother topic at 41 minutes in. I didn't bring it up with him, unfortunately. I should have if I was more prepared. Usually I do, but we're actually going to do quick fire question round, because I think it'd be good for clips in general, in all honesty.
Sure. We
answer each other short question, short answer, and we just kind of go back and forth. Now, to be fair, I haven't thought of any questions. I know you haven't, so this could be really bad, but we'll give it a crack, at least in the first one, and we'll see if it works. And just because I think it'll replace our question of the week, because that was, we gave it a good crack. I think we did it over 2 podcast recordings. We gave it a good crack, guys, but it just wasn't meant to be, unfortunately. It just didn't. I wasn't vibing it personally. Were you vibing it?
No, not in the slightest, but I was doing it because you wanted to do it.
I think this could be cool. We want to try something to spice it up, and this could spice it up, and it could be a bit of fun. Do you think it sounds okay?
Not in the slightest, no, I'm just kidding. Let's go. Sounds good.
All right, cool. So I don't have any questions, but I can quickly think of one if you don't have anything, like a quick fire question.
LDLs or RDLs?
SLDLs.
Ooh, okay.
Actually, no. I'll do a proper answer. So SLDLs for me every day of the week. Reason being is because you don't have many hamstring exercises to choose from. So when you're looking at your hamstrings, there's only really your hamstring curls, so seated hamstring curls, lying hamstring curls. Your hyperextensions, there's not really much else to do for your hamstrings. Now, your SLDLs are kind of a really, really big basis of growing your hamstrings. So when we're looking at variation overall, the important thing here is you kind of want to go like, you kind of want to look at the amount of exercises you have to choose from for every single muscle group and go decide how much variation you can go from there. So for example, with something like like chest, for example, pecs, there's so many exercises to choose from. There's a million. So you can be quite liberal with swapping things in and out and varying things up a lot. But with hamstring, because there's not much to choose from, you need to be very strict around like, okay, I'm going to do this exercise for this amount of time until it gets stale, and I'm going to replace it out with this. And then you got like a kind of a plan ahead of how you're going to go about your hamstring journey, because you need to be strict. You can't just choose like, oh, today I'm going to do this exercise because I feel like it. It's lesser so. Does that make sense?
Absolutely. Yeah.
And with RDLs, the reason being is because there's so many exercises to choose for glutes. Just choose something else. And what I'm getting at is because RDLs and SLDLs are pretty similar overall, you wouldn't want to do a lot of RDLs. And then once you get to SLDLs, it's actually not much of a variation at all. It's pretty much the same thing. And so you don't get that novel stimulus. You don't get that new feeling that comes about when you do something new. And it means that essentially you could be a little bit stuck. If you did RDLs for a really long time and then you became stale with the RDLs, you wanted to do a different hamstring exercise. Then you wanted to do a hamstring exercise, you went to SLDLs and you couldn't because it was pretty stale. There's not really much to turn to. And so you could find yourself in a bit of a trap.
Cool. Good answer. Nice.
Thank you. I'm trying to think of a nutrition one. Yes, please.
Okay. Smith machine squats or barbell squats?
They're both very good. I think Smith machine squats overall, especially if you have a good Smith machine. Reason being is because you can set yourself up a little bit better. You can force yourself into positions that are a bit more quad biased. And especially for me, I'm trying to bias my quads when I'm doing squats. I prefer it overall just because you can get yourself into those positions that are more forcing for quads rather than the barbell squats lesser so. Okay, all right. Let me give you a question. What genre would you like the question in?
I would say nutrition, but I feel like it's a little bit more tricky to ask.
That's it. That's all right. That's all right. What's your go-to meal after you train?
The absolute final answer to anything after training is whatever mum cooked. But realistically, I'm aiming for something with protein, with a fair bit of carbohydrates. Doesn't really matter if it's low GI or high GI, just looking to get them in to replace the energy that I've spent and really kind of speed up the recovery process. Again, it's not like I'm training to be a bodybuilder or anything along those lines. It's very much, it's like, it doesn't really matter to me. I'm looking just to get in food full stop. So there is a bit of an anabolic window that is present, but it's kind of overhyped by supplement companies because realistically, if you've had a meal within the past 6 or so hours, you're going to be using the anabolic window pretty efficiently just because you still have the nutrients in your bloodstream. The amino acids haven't gone anywhere. They're starting to kind of wean off a little bit. So having a meal in the next, I'd say,
2 hours.
Hour or so is probably going to be, I would say, optimal. Not that I really like the word, but if you skip a meal, it's 2 hours later, I wouldn't stress too much. It's only going to be, I don't even know how little of a percentage difference it would be in total muscular growth.
How would you utilize nutrition to improve your sleep quality?
Ooh, that's a great one. So I've noticed personally, and this is quite interesting, kind of goes against the literature. Anecdotally, I know that if I go to bed hungry, I don't sleep well. But in the same sense, if I have a high fat meal or a high carbohydrate meal, I also don't sleep well. So I'm generally aiming for something that's high in protein, relatively low GI if I'm looking for something snacky. Usually something that doesn't fill me up too much, but something that kind of sticks with what my normal sleep hygiene routine is. And again, you can absolutely change sleep hygiene as we go along. It's probably a topic for another day. What is sleep hygiene? No, it's not how you clean your sleep. It's not really how that kind of works. But I would aim for something proteiny. Usually it's going to be like a Greek yogurt with some berries or something along those lines. I find that's a pretty easy way to get some good calcium in as well and some decent protein at a complete whole source. So that's how I would generally structure that.
Cool. Nice. Guys, thanks so much for listening. I think that was actually a really cool segment.
It's really good.
I think we'll continue that.
Thanks
for listening, everybody. See you next week, guys.
Thanks, guys. Bye. Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.